Hi, my name is Julia Bova, and I work in the Office of Pain Policy and Planning at the National Institute of Health. Today, myself and my colleagues, Carolyn Conlon and Anthony Juni, are going to present an overview of the Helping to End Addiction Long-Term Common Data Elements program. This program is meant to harmonize data among HEAL-funded studies involving human subjects. The objectives of this lesson are to explain the biopsychosocial model of pain and why this model is important when assessing pain, to introduce everyone to the domains that are required to be measured as part of the HEAL CDE core for studies involving human subjects, to explain why the NIH HEAL initiative decided to standardize the domains in the first place and the process that they undertook to do so, to demonstrate for participants how to actually access and use the core questionnaires through the HEAL CDE Repository, and lastly, to explain and demonstrate the HEAL data ecosystem, a useful tool for all pain researchers to conduct secondary data analyses. So to provide a little bit of context for the HEAL CDE program, it's important to mention that the NIH has a data management and sharing policy effective as of 2023. So any investigator who receives funding from NIH should ensure that they are in compliance with the NIH data sharing policy, as well as any specific data sharing requirements of the institute or center from which they received funding. To that end, the HEAL initiative has its own data sharing policy, and the use of the common data elements is just one requirement of that policy, which is linked here. When we think about how to measure and assess pain, it's important to keep in mind that pain is not just a physical experience. It's a person's experience of pain encompasses biological, psychological, and social factors, which means that assessing pain in research must also account for each of these various factors, as well as how they can interact with each other. When creating the Common Data Elements program, NIH sought to move beyond just assessing pain intensity and consider a more holistic approach to measuring pain. Before explaining the process of developing CDEs and the required CDEs, we would like to point out a few relevant key terms here. A common data element is a standard, precisely defined question that is paired with a set of specific allowable responses. And CDEs are used systematically across studies so that data can be collected in a consistent and comparable way. A domain, which is often referred to as a patient-reported outcome, or PRO, is a broad aspect of a health condition that can be measured. Outcomes are basically what to measure in a study. A patient-reported outcome measure, or PROM, is a measurement tool or questionnaire used to assess the domain or outcome. This is how to assess something. For the HEAL CDE initiative, we use the term case report form to refer to PROMs. And then lastly, the HEAL core CDEs are a minimal and defined set of patient-reported outcome screening tools for each pain domain that are required to be collected for all HEAL-funded pain studies involving human subjects. This is an example of a case report form right here, or a patient-reported outcome measure. The PROM here is called the Brief Pain Inventory Pain Severity, and then the CDEs or common data elements are highlighted in the red box here. And these are basically the individual questions with a set of permissible values. Here, there are examples of common data elements. So as you can see, each CDE has a name that is pulled from the case report form, such as the Brief Pain Inventory, as well as the definition, the description, the variable name, and then the sets of permissible values. It's important to mention that all of these items must be standardized for each CDE to ensure data interoperability and comparability when the data is collected and then later uploaded to a repository. The 10 core domains for the HEAL CDE program are listed here. The domains are in the top row, and then in the bottom row are the associated patient-reported outcome measurements for each domain. Now that we have familiarized you with some of the key relevant terms for the HEAL CDE program, I will provide an overview of why and how the program was created. The HEAL initiative decided it was important to establish a comprehensive set of core domains for both chronic and acute pain that all HEAL-funded pain researchers should use within their studies. The core outcome sets were also developed to assess all pain conditions within the NIH HEAL initiative. And this was done because there was an opportunity for the pain research community to access quality data across pain conditions in diverse populations and across multiple interventions. The ability to compare results across trials was also important, and to be able to quantify the impact of interventions. This slide provides a brief overview of how the HEAL CDE program established the core set of domains and measures. So first, NIH staff conducted a semi-systematic literature review to identify important pain domains that should be assessed in research. After that, NIH program staff collected domains that were associated with the research, and they focused on the most common domains. And then they reduced the list of pain domains. They then sent the reduced list of pain domains to Impact, and Impact provided feedback on those domains. They went back to the literature and conducted another literature review to identify questionnaires or prompts for each of the domains and collected a list of prompts. The things that they considered when they were selecting the prompts were the number of questions, the validity of the questionnaire and use in clinical trials, use and validation across populations, and whether the measurement tools were important to people with lived experience. Throughout the entire process, the NIH staff were also trying to ensure that the domains and the questionnaires were holistic in nature and encompassing the biopsychosocial model of pain. After selecting prompts, Impact again provided feedback on them and recommended some minor edits. And then HEAL-funded PIs, once they were awarded, also had a chance to provide feedback on the core domains and prompts. After which, the NIH finalized the list of core pain domains and prompts. And then it's also important to note that the HEAL Pain CDE team updated the core domains in 2024. I will now turn it over to my colleague, Carolyn.
Thank you, Julia. HEAL pain research grantees studying human subjects are required to assess pain intensity, pain interference, physical functioning, quality of life, sleep, pain catastrophizing, depression, anxiety, global satisfaction with treatment, substance use screening, prescribed opioid MME, and demographics. As you can see here, the prompts or the questionnaires are determined by whether the grantee is studying acute pain in adults or chronic pain in adults. And as you will see on the next slide, the prompts are also determined by population in regard to adult population or pediatrics. For example, you can see here that the Promised Physical Functioning Short Form 6B is a core measure for these HEAL studies to understand physical functioning abilities within adults who experience acute or chronic pain. I want to point out that these domains are not only focusing on pain, but also, as you can see, anxiety, sleep, and so on, in order to understand the participants' biopsychosocial factors to holistically acknowledge their pain experience. I do want to note that these HEAL studies are required to collect the data from these prompts at 2 time points, at baseline and follow-up. This table displaying the prompts required of the HEAL pain research grantee studying pediatrics. As you can see here, the domains remain the same as the adult measured domains. However, the prompts differ. For example, for pediatrics, physical function is measured within PedsQL rather than the Promised Physical Functioning Short Form. HEAL pain research grantees are required to collect the demographic questions, as mentioned in the previous slide. Here are the demographic questions requested of the participant. In 2022, the RUGA code was added as a core demographic CDE. In 2024, a social determinants of health question was added as a core demographic CDE as well. Study teams often add further demographic questions based on their study population. If study teams do decide to add other demographic questions, these are considered supplemental questions or CDEs. As of fall 2024, HEAL pain research grantees are now required to collect an opioid morphine milligram equivalent or MME calculation. The opioid MME calculation is the amount of milligrams of morphine an opioid dose is equal to when prescribed. Calculating the MME accounts for differences in opioid drug type and strength. Therefore, studies are required to collect the name of the opioid, the dosage, and the prescription duration to obtain an MME value. This information is required for each opioid for each participant in the study. As mentioned prior, if HEAL pain studies want to utilize CDEs outside the HEAL required questionnaires, they can, and many do. These are considered supplemental CDEs. These supplemental CDEs are many times specific to the study population. For example, a grantee who's studying migraines, they may want to utilize, as shown here, the questionnaire MIDAS, which stands for the Migraine Disability Assessment Questionnaire, to assess headache-related disability. To encourage studies to utilize the questionnaires or CDEs that are already in the HEAL CDE repository. This allows for a secondary analysis to be completed across multiple studies. For example, if there are 2 grantees studying migraines and need to assess headache-related disability, we would encourage the use of MIDAS for the second study so that the data from this questionnaire can have a secondary analysis completed. Now, I want you to think about what you may want to consider when choosing a PROM. Displayed are a few questions to consider, such as, what is the treatment your study is trying to assess? What PROMs have similar studies used? How can the study assess the treatment holistically? What outcomes are important to people with lived experience? What will their burden be on study participants? Or are there required CDEs you need to use for your study? Now I'm going to show you the HEAL CDE public repository. First, I'm going to show you the display of these PROMs. We will review the adult demographic PROM as it was described in a previous slide. So this is the HEAL CDE public repository. And as you can see here within those PROMs, there's the description, which has the PROM name as well as the description, the file name, which includes the 508 compliant case report form, and the common data elements. We also have the file language. So in this adult demographic case report form, it is in English. And then here we have whether the PROM is core or supplemental. So in this case, the adult demographic is a core measure for the adult population as for acute or chronic pain. And then here we have the research topic or domain. So this is the demographics domain. This link will populate the 508 compliant case report form. And this link will populate the common data elements. I do want to note that all common data elements are in English. So this file language is only for the case report form. So now I do want to show you the search functions of the repository. Since we talked about migraine in the past, I am going to type in migraine and show you what populates. So migraine it'll search for the description or the domain. So as you can see here, migraine populated within the description as well as different domains. And now I'm going to show you the search functions, other search functions we have. So now I'm going to click reset. So it resets from migraine. Here you can search by core or supplemental, as well as if it's adult acute pain, adult chronic pain, or for pediatrics. You can also search for the domain or research topic. You can search for the case report form file language. And you can also search if the PROM is copyrighted. So I'm going to click yes in this case because I do want to show you what it'll look like when a PROM is copyrighted. So here I'm going to show you an example of TICS, which is the telephone interview for cognitive status, which is copyrighted. So I'm going to click on the file name and it'll download. As you can see here, we have the name of the PROM and instructions on how to obtain the license or permission of the PROM. Once your team has obtained the license or permission, email the HEAL CDE email listed here, and they will send you the common data elements. I do want to note that if you are a HEAL-funded grantee studying pain in human subjects, the HEAL CDE team will purchase the copyright license or the core case report forms. However, these studies will be responsible for purchasing the licenses and any copyrighted supplemental questionnaire. Lastly, you will see that the languages that we have available in this form. In this case, we only have the English case report form available. Now, I would like to pass to my colleague, Anthony Juni, to talk about the data ecosystem.
Thank you so much, Julia and Carolyn, and hello, everyone. My name is Anthony Juni, and I serve as the program manager and data scientist for the HEAL data ecosystem under the direction of Dr. Jess Mazarek. I want to begin with a few summary level setting points, then dive into the overall strategy and design of the HEAL data ecosystem. So just as a reminder, real quick, HEAL is charged with incentivizing data sharing and data reuse to expedite discoveries addressing substance use and chronic pain. The HEAL CDEs support implementation of clinical domains and measures in a standardized way for all human clinical investigator teams. The CDEs support harmonization and comparison of common measures across teams, and the resources provided in the HEAL CDE repo support easy implementation of the HEAL CDEs within diverse data collection and management pipelines. One key takeaway I hope to frame today is that as HEAL studies begin to share their data, rigorous data and metadata curation is crucial for both discovery and reliable data reuse, and the HEAL data ecosystem has carefully incorporated the HEAL CDEs into our overall design and metadata strategy. One overarching principle in the development of the HEAL data ecosystem is to make it as easy as possible for both those sharing data and those reusing data to get the most value out of the data coming from HEAL studies. So how do we do this? HEAL-supported research is generating a large variety of data types across diverse research domains, from preclinical to clinical and population health, imaging and omics data to tabular clinical data and qualitative data. HEAL-funded studies are required to deposit their data in HEAL-compliant repositories for long-term storage. Many of these repositories offer domain or data type-specific curation support and governance of access control for sensitive data. The HEAL data stewards have carefully defined this repository list and provide direct support to help HEAL investigators determine the repository most appropriate for their study. The HEAL data platform in the middle of this slide is a data mesh providing a structured environment wherein users can search, discover, access, and analyze data from NIH HEAL-funded studies stored in those external repositories. The platform does not directly store data, but instead leverages multiple levels of metadata to support the findability, accessibility, interoperability, and reuse of HEAL data and multiple use cases for diverse user groups. Users can search studies on the platform, gain access to detailed information, including study-specific CDEs being collected, as well as access to studies data and associated digital artifacts such as protocols and analysis code. Platform users can conduct secondary analysis across studies, leveraging CDEs to uncover insights at the intersection of pain and addiction. Users can collaborate with other researchers and studies working on similar topics or using similar CDEs. And finally, the HEAL data platform and HEAL semantic search knowledge graph offer robust tools for exploring data supported by detailed metadata. These tools provide deeper insights into how data points are connected, helping researchers understand relationships between studies and datasets and CDEs. So, what are metadata? Metadata are the crucial driving force for the HEAL data ecosystem. The HEAL platform leverages multiple levels of metadata to power search and discovery tools, supporting platform users in finding studies and data of interest to their needs, as well as harmonizing and analyzing data. This slide demonstrates the levels of metadata and how they are hierarchically related. From higher level study level metadata at the top right of your screen describing the research focus area and cohort characteristics, to variable level metadata moving from the left to right on your screen, describing individual study data elements. Think of this as a data dictionary. CDE and related semantic information can also be embedded within this variable level metadata, which support linkage of case report forms, biomedical concepts, and semantic ontologies and standards. One major goal is to make the process of provisioning this metadata as simple and streamlined as possible. Thus, the HEAL platform leverages metadata from multiple external sources, including clinicaltrials.gov and NIH Reporter, and links directly to the HEAL CDE repo to both support variable level metadata curation and traceability to the CDE repo materials supporting implementation and reuse. Let's take a quick look at what can be achieved with these metadata by diving into the backpack study on the platform. From this study's metadata record, if we explore the metadata extracted from clinicaltrials.gov on the left side of your screen, we can quickly determine it's a multi-site clinical trial implementing interventions for chronic low back pain, measuring the secondary outcome of change in opioid medication, as you can see on the very bottom left of your screen. By diving into the variable level metadata record for this study on the right side of the slide, we can see they use an extended version of the TAP CDE with an additional element measuring daily opioid pain medication use at multiple time points in the study. When we pull these backpack data into a platform workspace shown at the top of this slide, recall how the variable level metadata shown in the previous slide allow us to more readily understand what the variable opioid 01 means, and thus we can more reliably work with this data when building and interpreting our analysis. In addition, these variable level metadata support more reliable data harmonization and comparison across teams, as well as the opportunity to build larger, more generalizable models of pain and addiction driven by more reliable data access across HEAL studies. The HEAL platform and data steward teams have built multiple resources to support investigators in understanding the value and importance of data curation and data sharing, as well as tools and guidance to make implementation of best practices and standards as easy as possible. I encourage you all to explore this study records and data available through the platform. If you're interested in learning more about data management and sharing best practices implemented across the HEAL data ecosystem and HEAL compliant repositories, the HEAL Data Stewards website provides a litany of fascinating and easy to understand resources. Please do explore the links at the bottom of this slide for additional resources, and thank you all for your time. And with that, I'll pass it off to Julia to close this out. Thank you.
So to recap what we have learned in this lesson today, we would like to re-emphasize the importance of considering the biopsychosocial model of pain when assessment in pain research. The NIH HEAL initiative considered pain holistically when developing the core CDEs, which is a set of patient-reported outcomes and questionnaires that all HEAL-funded PIs studying human subjects must measure. However, researchers are expected to measure additional outcomes that are specific to their study aims, populations, or interventions. The HEAL CDE program was created to enable data harmonization for the field of pain research, so that study results can be more easily compared to better understand and improve pain treatments moving forward. To support this goal, the HEAL data ecosystem is also a very useful tool to support secondary data analyses because it allows anyone to search for data that has been uploaded by HEAL investigators. Users can also search for studies based on outcomes, health conditions, interventions, or populations, among other variables. With the HEAL CDE program, through both the core CDEs and the supplemental CDEs, our goal is to put in the work now to align outcomes and questionnaires for improved data harmonization so that in the future, researchers and other stakeholders can more easily compare data across studies, perform statistically significant analyses of study results, and enhance pain treatments ultimately. Thank you very much for taking the time to learn about the HEAL CDE program. Here we have provided a list of links and tools related to the HEAL CDE program and ecosystem, as well as other NIH resources and CDE requirements from other institutes and centers. Additionally, these webinars dive further into the HEAL CDE program and data ecosystem. For HEAL-funded researchers, these webinars and tutorials provide information about data sharing requirements and processes for registering and uploading your data into a HEAL-compliant repository. Lastly, if you have any follow-up questions about anything you heard today, we have listed the contact information for both the HEAL CDE program staff as well as the HEAL Data Ecosystem program staff. Thank you again.